you're likely to be considering knee surgery if you've got pain and you want that pain to get better. The reason for trying to avoid surgery is that pain might get better on its own. For example, a meniscal tear, which is a torn cartilage that pops in and out of the joint, might be causing you quite sharp pain, the sort of pain that makes you go, oh. And that tear might round off on its own over time. So it's worth giving things 2 or 3 months just to see if that pain is going to settle down on its own. There's some things you can do in the meantime to try and help that, and we'll maybe cover that during this video. The non-surgical alternatives. I'd be looking at optimizing strength and optimizing body weight. Really, whether you're going to go ahead with surgery or trying to avoid surgery, those are your 2 main priorities, the 2 things that have been proven time and again to help when you look at the research literature. Generally speaking, that involves moving more and eating well. I often hear from patients that they can't move more because of their knee pain. That's why I recommend exercise bike cycling or static cycling as a low impact way to get started. You want the seat nice and high, so the knee isn't bending right up, and start pedaling. I'd be aiming the first time you get on the bike to just do 1 minute. You want to be able to do 1 minute per day in the first week. If you do 20 minutes straight off, then your knee will scream at you and you'll be put off cycling. Do 1 minute on the first day, you can do 1 minute on the second day, and 1 minute every day for the first week. And then look at building up slowly. So you do 2 minutes a day in week 2, 3 minutes a day in week 3, until you're doing 10 minutes most days. And that sort of regime has been proven to help with knee pain as the muscles around your knee get stronger. Short answer is very definitely yes. If you look at a torn meniscus, a meniscal tear, 70% of these will get better on their own without knee surgery. So really does depend though on what condition. So it's important to get an accurate diagnosis. The benefits of avoiding surgery are that you avoid the risks of surgery. The risks are small, but if they do happen, they can be a big problem. So if you can avoid surgery, that's better for you. And you can always opt for surgery at a later date, some point in the future. So don't feel under pressure to go ahead with surgery. You can always see how things go for a few months and arrange another appointment online or face-to-face with your surgeon or doctor, just to see how things are going. Try a non-operative approach first of all, because you've really got nothing to lose. Again, that can depend on what the condition is, what your underlying problem is. Overall, when you look at all people with knee problems, knee osteoarthritis in particular, the evidence shows that improving strength in the muscles around the knee and optimizing your body weight will improve your pain. However, if your pain does get worse, then get back in touch with your doctor or speak to your surgeon, and then you can talk to them about the risks and benefits of surgery again. There's nothing to be lost by giving things a bit more time. Diet, nutrition. Let's talk about diet and nutrition. It's so important, especially when it comes to knee pain. We put about 5 times our body weight through the knee when we walk. So if you're 2 stone overweight or carrying an extra 10 kilos, then that's an extra 10 stone or 50 kilos pounding through your knee with every step you take. And we take between 1 and 3 million steps a year. So it's like hitting your knee with a 50 kilogram or 10 stone mallet every time you walk. So that's really the biomechanics of excess body weight. But there's more and more evidence now that high body weight and excess body fat itself contributes to inflammation, to whole body inflammation. So if you're overweight or obese, then both the biomechanics and the biochemistry can cause inflammation that leads to pain and disability. The flip side of that is that if you set target weights and aim to hit those target weights over a 12 to 24-month period, then you will find that your pain does get easier and that things do settle down. So eating well and improving body weight does improve inflammation and pain.